All right, so my name's David Thomas. I work here at Menzies School of Health Research in Darwin, and I also spend a day a week on secondment at AMSANT, and I'm also a consultant to the National Best Practice Unit. And before all that, I worked at Gunapa Health Council, Congress and Dunladuba, where some of you are from. I've lived in Darwin for half my life, here on Larrakia country, where both my kids were born. And I've had the good fortune of working for and with many Larrakia people and many Larrakia elders, including some who have sadly passed. Now, I only heard about this yesterday, so there's no PowerPoint, which you'll probably be pretty happy to hear. And so I'm just going to talk. Now, this morning we've heard quite a lot about the Tackling Indigenous Smoking program. And I think later on we're going to hear more about what the regional teams are doing in their communities. But of course, that's not all that's happening here in the NT to reduce Aboriginal smoking. As well as mainstream, national and NT campaigns and policies, for example, the TV campaigns, the tax rises that Tom talked about, the graphic warning labels on the packs of cigarettes, the smoke-free laws and all the laws about the display of tobacco at retail outlets. There's also what's happening inside the clinics, which Tom mentioned, and there's also what's happening in places where there is no TIS team, for example, in places served by NT government clinics. Now, I'm just going to talk, as the title suggests, about coordinating some of this tobacco control action and policy. And in particular, I'm going to talk about two groups that are trying to coordinate all these activities that are going on here in the NT. And they're really important because they're important so that we learn from each other and support each other about what seems to be working best in the NT and how we can help each other. Now, I should also acknowledge that some of you are already involved in these groups, but for some of you, it will be new and it's worth letting you know about them. Now, the first of these is around something called the NT Tobacco Action Plan. So PROP, that's what it looks like. And afterwards I can probably try and find a link for it, or someone who's clever can find a link for it on the NT government website if you Google NT Tobacco Action Plan. So as is clear, that's an NT government plan. It has four main focus areas: smoke-free spaces, marketing and campaigns, sustaining quit attempts and preventing relapse, and then priority populations, pregnant women, young people, people who've been in prison, and people with mental health problems. And across all of those four areas, the focus is very firmly on Aboriginal smoking. That Tobacco Action Plan is monitored by something called the NT Tobacco Control Action Committee, which has members from various organisations, both the NT government, different NT government departments, not just the health department. You know, for example, we have licensing and education involved, AMSANT, and importantly also includes some of you from the TIS teams in the NT. And I chair that committee. And it's important that we have someone from outside the NT government chair that committee, which has been running off and on for quite a few years. because it means that we can sort of like say when the government's not doing what it should be doing, as well as, you know, give it some positive support when it is doing good things. And we can talk in the media, and we have in the past. And so, for example, when the NT government was the last place in the country to protect kids in cars from secondhand smoke, we made a little bit of a fuss in the media, and eventually they got their act together. So that committee meets 4 times a year, and it's quite nice because the plan has 4 elements. Each time we meet, we focus on one of those focus areas. And indeed, we met only earlier this week for one of those meetings, and we were actually talking about sustaining quit attempts and preventing relapse. We also have produced annual reports. There's only been one so far in the current iteration of the committee. That's what it looks like. And I think someone's already found the plan. So if they're really clever, they can probably find the annual report from 2019 also on the NT government website. Then, as Trudy hinted, there's also another coordination also happens through another group. So here in the NT, we have the NT Aboriginal Health Forum, which coordinates Aboriginal health policy in the NT. And that has, as I think Trudy had a slide, it brings together regularly senior people from AMSANT, the Commonwealth Department of Health, the NT Department of Health, the Primary Health Network, and the National Indigenous Australians Agency. And as Trudy hinted earlier this year, they decided to set up a special tobacco working group with reps of each of those organisations, which is now, as she said, meeting monthly. And I chair that as well, because I was already being seconded to AMSANT and do so in that role. And we've also asked Maxine, and she's joined that group as well, given her role in talking to all UMOB. So this tobacco working group, as part of the NT Aboriginal Health Forum, has a slightly different role to the NT Tobacco Control Action Committee. The first is to really look at the evidence about progress here in the NT, and particularly in remote areas, and really start to pull together that research evidence about what is working in remote areas. So that's the research side, pulling together the evidence. The second is to consult with those working in health promotion, like all UMOB working in the TIS teams, and also the clinicians, working in the clinics, the doctors, the nurses, and the health practitioners, about what seems to be working and if there are any barriers. And again, I've already talked to some of you about that, and I will be talking to more of you in that regard. And finally, even though we only got going a couple of months ago, they want us to develop a draft plan for all health services in the NT to improve tobacco control and how to better support people, and then even begin to support the implementation of that. So it's got a bit of work to do. Now, as Tom said at the start, and I think Raglan and Trudy all sort of said, nationally there's been no improvement in Aboriginal smoking prevalence in remote areas. I think it's really important to also emphasise that improvement is possible. This is not kind of too hard. As everyone before me emphasised, Aboriginal prevalence is coming down in non-remote areas, and of course, and it's also coming down in the whole Australian population. But even amongst Aboriginal people living in remote areas, which all of the NTEs except for just here in Darwin, we're seeing that fewer and fewer kids are taking up smoking in the same surveys that are showing no change in prevalence. More and more smokers are making their home smoke-free in the same surveys. And more smokers have made a quit attempt in the past year, again, in exactly the same surveys. So it is not true to say that nothing is working in remote areas. Now, one of the key messages that's come up in some of the early consultations with health staff that I've done is the importance of stress. Now, obviously, in the communities we work, there are many real reasons for stress, whether they be crowding in your house, worry about your kids, people getting sick, having to leave to go to hospital. Obviously, at the moment, people are concerned with all the COVID stuff. It's violence, and grog can come in and cause problems too. But health staff have told me several times, and I've heard this before, is that they're worried that sort of smokers are saying that they're smoking in order to manage this stress. And similarly, smokers are choosing not to quit or are not succeeding because they say they need these smokes to help them manage their stress. But, and this is, Tom hinted that we've done some national research on this. When we talked to Aboriginal and Torres Strait Island smokers around the country, we found that of the people who'd quit in the past year, 3/4 of them said they cope with stress just as well as they did before they quit when they were smoking. So after you quit, people say that they're just as able to cope with stress as when they were still smoking. And also, smokers who reported being, much more stressed when we talked to them the first time, when we came back a year later, more of those who had reported being stressed than those who were not so stressed were likely to have made a quit attempt in the year that in between time. So stress does not inevitably need to be seen as an obstacle to quitting smoking. And indeed, there's some kind of interesting stuff in the international research that suggests that the benefits that people say there is for smoking in helping them manage with stress, may be an illusion, may be fake, may be gammon, maybe not real, and now the reason for this is not that the stress is not real. The stress is real. But we all know about the nicotine in cigarettes, the addictive nicotine, chemicals in cigarettes. And that when people try to quit, they don't get enough of this nicotine, and they get all these cravings, they feel awful, they feel stressed, their body feels awful. And that's because the nicotine levels have come down. But indeed, this is probably happening many times during the day when you're a smoker. When you smoke a cigarette, your nicotine levels go up very quickly. But after you've finished that cigarette, the nicotine levels start dropping quite quickly. And so you're really having a mini withdrawal after each cigarette. And so you start getting those sort of cravings for a cigarette, and your body starts feeling not as good and a little bit stressed until you have that next smoke. And then, of course, your nicotine levels go up and those symptoms go away. And so for smokers, smoke, might smoke 15 cigarettes a day, 10 cigarettes a day. They're doing this many, many times during the day, and they've often done it for many years. So the body gets very used to this association between, not smoking and stress. And, when you get that next cigarette, the stress going away. And indeed, that relief, because it's happened so many hundreds and hundreds of times before, can even start happening, when you, get out your lighter, before you even light the cigarette, your body's so attuned to it. So the message is that while people will often feel sort of quite stressed and, get all these hard cravings in the first couple of weeks when they're withdrawing from nicotine, unless of course they use the NRT, if they do succeed, they will be just as able to deal with stress and won't have to deal with that, daily stress and cravings every time they've gone a while without a smoke. Or indeed feel bad about not quitting, because we know even in remote areas, most smokers want to quit and most smokers try to quit at least once a year. So on that tobacco working group, we've started to wonder and talk about whether we need to talk more about these understandable but probably fake stories or illusions about smoking to reduce stress. And so we may well need to sort of like both as TIS workers talk about this much more in the open, maybe in marketing materials, sort of like deal with this more directly, and of course in the clinic. So this is sort of like some of the things that have come up in those discussions already. So I think with that, I might just say, certainly if we've got time for people to make some comments about stress, I think that might be useful or interesting. But in the meantime, thanks for listening. I think so the key message is that there are these other forums that are sort of like trying to coordinate what's going on here in the NT. I'm always able and available to talk about what you're doing. And after I get off here, I'll pop my email on the thing if that's not already shared. And I've already obviously talked with quite a few of you, and a lot of you already know me, and I'm very happy to chat about things. And as I say, if anyone's got any thoughts about talking more and sort of telling this true story about stress and smoking, that would be kind of interesting. So that's me.
Thank you, David.